this is the Warfarin station, right?
Wait. This is
Warfarin
Warfarin
communication.
concentration.
Yeah, okay.
Oh, wait. This why is it asking me to create? Okay. Yes, so I think I've started, and here is your stamp.
Okay, I'm ready, ma. Is my
Both
voice
are ready?
clear?
Yes, both are ready?
Yeah.
All right, so if you've read and understood, considering 8 communication skill station, please begin.
Hello, good evening.
Evening, doctor.
I am Dr. Abdelgader, one of the surgical doctor here today, taking care of you. I am sitting now in front of you. Can I confirm your name and age, please?
I'm Muhammad and I'm 60 years old.
Who? Sorry.
Muhammad.
Nice to meet you, Muhammad. I
Yeah.
understand that you have a concern about stopping your warfarin medication. Can you share your concern with me?
Yes, doctor. I had a cardiac surgery 20
Mhm.
years back, and it was really scary. I had to stay in the hospital and all. And my doctor at that time told me that I have to take this medicine for lifetime, and I can miss my food, I can miss my sleep, and I should not miss these tablets. But now people are asking me to stop my warfarin tablets. I cannot do that.
I understand your concern. I really appreciate you sharing it with me. I just want to say first that I am really proud of you that you are taking care of your own health and you are taking your doctor advice seriously. So let me explain what is warfarin, why it was explained for you, and why we need to stop it, and how we are going to manage your case after stopping it. Is that okay?
Yes, doctor, because I'm really worried and I don't know if I'll be able to do it.
I feel for you and I appreciate your concern. I will make anything clear. I will make it very simple. Please, if you had any question, don't hesitate to stop me or ask me, okay?
Yes, doctor.
So what is warfarin and why it was prescribed for you? Warfarin is mainly blood that's is a medication that's in our blood and prevent clot formation. You know how the blood run in our body like fluid running in a pipe. So are you following with me?
Yes.
So sometimes this blood get lumpy and make like a jelly set. We call it a clot. So clot is not a bad thing. It really helps us to stop bleeding when we have any injury. But in your case, you had an artificial valve 3 years ago. So we are taking warfarin to prevent this clot from being around your artificial valve. So, however, we are planning to do you a surgery. So we need to stop your warfarin because it carry a high risk of operative bleeding and after the operation bleeding. So that's why we need to stop it. Okay? Are you following
Yes.
with me?
Yes,
Okay.
doctor, but what about the clots? I was told that clots can also cause stroke and heart attack and whatnot.
Okay. Of course, that is really a good question. Of course, we are not going to leave you uncovered. We are going to stop warfarin uh, 5 days before the operation, and we are going to replace it with a blood thinner. We call it injectable heparin. So we are not stopping warfarin. We are replacing it with another blood thinner, which act as the same as warfarin. It prevent the clotting and it protect you from the clotting in your artificial valve. So it acts the same. So you may ask me, some question may jump into your mind. So why we are stopping it? Why we are replacing it? So I want you to think of heparin like switching a light on and off. It acts very fast. While warfarin, it takes some time. It's very slow. Takes some time to work, and takes some time for it effect to wear off. Are you following with me?
Yes, doctor, but I'm still not sure. Like,
Yeah.
How if heparin is also a blood thinner, so how it will prevent the bleeding in the surgery?
Okay. So after that is a really good question. I am really glad you asked this question. So as I told you, we are stopping it. We are replacing it with heparin. So why heparin? In advance of it short time act and short time for it effect to wear off. So it allows for a better control. So we are going to give you this heparin, which is going to stop your bleeding, and at the same time we can stop prevent your clotting, and at the same time we can stop it just 12 hours before the surgery, so we can reduce the risk of bleeding. So you are not being unprotected. You are covered as you are taking warfarin with reducing the risk of bleeding.
All right, I think I'm getting there now. But doctor, you said this is an injection that this heparin. So I am not able to. I will not be able to manage it on my own. So will I have to continue it after the surgery as well?
Okay. As you cannot take your heparin injection by yourself, we can arrange a nurse community for you. And if that is not working for you, you need to be admitted here with us before 5 days before the surgery, so you can take it in the hospital.
Okay, and what about after the surgery? Will I have to continue the heparin in place of warfarin?
Okay, we are going to restart warfarin again while continuing with heparin. As I told you, it takes some time for it effect to start and for effect to wear off. So we are continuing with heparin. At the same time, we are going to give you warfarin. So we are going to do some blood tests to make that the warfarin in an action, and it is in the good levels. Your blood test in a good level. Then we are going to stop the heparin. But before we starting it again, after this operation, we have to make that the bleeding is well controlled and there is no risk of giving you the warfarin again.
Right, doctor, but staying in hospital is not that easy. So can you give me an exact estimate of how long I will have to stay?
You mean after the operation, Mr. Muhammad?
Yeah, but you said I will have to get admitted before the operation as well.
Yeah, it's really difficult to tell the exact time. It's usually a day care procedure in which the patient go home immediately. But it actually depends on your recovery from the anesthesia, which is a medication we give it through your veins that make you feel sleepy and feel no pain for the operation. So it is usually at the same day, but that is not 100% in all cases. We have to make that you are in a good recovery and you are good to go home.
Right. So I take other medications as well for my hypertension and for my
Mhm.
anxiety. I take diazepam. So will I have to stop those medicines also?
Okay, I understand your concern. Really, thank you for notifying me about your medication. No, there is no need to stop it actually, Muhammad. You can take it just with a little sip of water in the morning of the procedure. Just a little sip of water.
Okay, thank you, doctor.
Do you have any concern or any other question?
Not at the moment.
Okay, please don't hesitate. If you have any question, please don't hesitate to inform me. So, do you agree to stop your warfarin medication?
Yes, I think I don't have any other option.
Okay, thank you very much. If you have any question came into your mind, please don't hesitate to tell me.
Thank you, doctor.
Thank you.
Yes. Meanwhile, sign the consent form.
Okay, sign the consent, yes.